stands at, in terms of the rates, our rate remains at more than 700,000 people that die by suicide worldwide. And then for every day, there is a typical many more attempts. If we are to come back to Namibia suicide rate was estimated to be at 8.6 per 100 population in 2021, making it one of the lowest in the SADC region, compared to countries like Lesotho, which stands at 28.7%, Eswatini, which stands at 27.2%. However, in recent years, the number of suicide cases has increased steadily throughout the years, rather than peaking in September and October and so forth. Those are and in the recent also, we are saying that Namibia has experienced the unusually high number of suicide, including, some other factors that has been alluded to as the contributing factor.
And I mean, the ministry has made a reference to a seemingly cluster of suicides or copy suicides possibly triggered by media reports. Walters, can you just elaborate on that?
On that?
Can you just elaborate on the reference that was made by the ministry about, cluster of suicides or copy suicides that are possibly triggered by media reports?
All right. Yes, we are just saying the way the media reports sometimes, or the reporting format can have an impact on these cases, either to influence the reduction or to influence the increase in one way or another. So, in other words, we're just looking at the sensitivity reporting about it, whereas sometimes the way these cases are being reported, they are just reported as news, not being reported as sensitive cases, taking into consideration that these are other than to look at it beyond news, you should see to it that these are people with relatives, with kids, and so forth. And then some other reports which are not given into a sensitive manner can perpetuate it or can influence it in one way or another.
So basically you're saying that emphasis is being placed on responsible and sensitive reporting. Are there certain things or details, or rather, that may be or may appear insensitive when journalists report on these issues?
Yes, one example that I would give that I've experienced myself, there was a case, let me just not taking much time. So the issue of reporting, when there's somebody trying to commit suicide, sometimes the way we react, even as family members, it can influence it. I remember there was a time when we were at Katutura, and then there was a patient who came through the window, and then he was at the 6th floor, and then he was attempting to jump over. So when people gathered to come and watch, and then this person was battling between the issue of should I complete my action, should I retract my action. So by the time I came there, people tried to watch, people tried to dramatizing this. They were trying to make it as if it's a movie. And then at the end, the person has to battle between the two things that now, should I retract or should I proceed? If I retract, will people see me as a coward? So in the end, when people were there, when we were trying to negotiate, finally the person jumped. And then when we tried to negotiate with the person, then when we engaged the person afterwards, the person says that when I was there, it was not my intention to jump, but I looked at the people around me and I asked myself, what would they say of me if I didn't jump over? So these are the things that sometimes we are talking about.
Yeah, just in addition to that, Walters, as well, there's a thin line there with how we, as journalists report or tell a story. So what do you perhaps suggest on how we can narrate the stories as to what the story actually is and how you think a story should be, written around sensitivity, of course?
Thank you very much. The story should be written with a background that these are people that have... That these are cases which are so sensitive. And then these are the things that we should report about, that even when their relatives look at these stories, read these stories, there are stories that does not expose some certain information. There are stories that does not trigger some people to complete things or to create more further damages. But these are stories which should be more encourative, more educative, and more preventive, so that in the end we should have fewer cases of that nature.
Just to take you a little bit back, Walters, perhaps if you can elaborate more, in which ways do you think the media can partner with stakeholders in creating awareness about, mental health? Because this is where it all begins in most cases.
Sorry, I missed that.
How can we, as the media, better partner with other stakeholders to create, awareness about mental health? Because we all know this is where it actually begins in most cases.
Thank you very much. The stakeholders, like the Minister of Health and Social Services, we have convened a meeting now at Avani, which is ongoing now, whereby we are engaging with stakeholders, sensitizing one another on the format of reporting as well as the sensitivity of it. So there are ongoing discussions that the Minister of Health and Social Services are conducting just to give information to the people. And we have collaborated with WHO. And then these are essential and these are important workshops whereby people can get the most needed information.
Mm-hmm. Well, lastly, Walters, does the ministry has any sort of targets on reducing or preventing suicide cases?
Yes, previously we just celebrated or commemorated the World Suicide Day. The aim of the ministry is to get every case to zero.
Yeah.
We don't have a case that just will reduce it, but the most concerning thing is that we should not experience an increase, but we should experience a decrease whenever. It should be that this year should be different to next year, and then the other year should be different to the other. So we are aiming to have a decrease every time.